Hello, nursing students. Welcome to Nursing Exam Preparation, your go-to channel for excelling in nursing exams with confidence. In today's video, we'll guide you through 120 multiple-choice questions, MCQs, on gastrointestinal nursing, each carefully designed to challenge your understanding and expand your knowledge of this essential topic. Detailed explanations follow every question, helping you not only answer correctly, but also grasp the reasoning behind each answer. Whether you're just beginning your studies or revising for your exams, this video is packed with content to test your skills, enhance your critical thinking, and reinforce fundamental gastrointestinal nursing concepts. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more invaluable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and work toward mastering gastrointestinal nursing and achieving exam success. 1. A patient with a history of GERD, gastroesophageal reflux disease, is prescribed an antacid. What is the primary purpose of this medication? A. To increase gastric acid production. B. To neutralize stomach acid and relieve heartburn. C. To coat the stomach lining and prevent reflux. D. To stimulate motility in the GI tract. Answer. To neutralize stomach acid and relieve heartburn. Rationale. Antacids work by neutralizing gastric acid, which reduces heartburn and discomfort associated with GERD. Option A is incorrect because antacids do not increase gastric acid production. Option C refers to mucosal protectants, and Option D pertains to prokinetic agents. 2. Which of the following is a common symptom of peptic ulcers? A. Constipation. B. Abdominal pain that improves after eating. C. Severe nausea and vomiting without relief. D. Heartburn that occurs after meals. Answer. Abdominal pain that improves after eating. Rationale. Peptic ulcers often cause gnawing abdominal pain that may improve temporarily after eating. Option A refers to constipation, which is not a common symptom. Option C may occur in other conditions, but it is not typically linked to peptic ulcers. Option D may indicate acid reflux but not ulcers. 3. Which of the following is a nursing intervention for a child with dehydration from diarrhea? A. Administering high-sugar drinks to replenish electrolytes. B. Encouraging the child to drink water frequently. C. Providing oral rehydration solutions containing electrolytes. D. Limiting fluid intake to prevent further loss. Answer. Providing oral rehydration solutions containing electrolytes. Rationale. Oral rehydration solutions, ORS, contain both electrolytes and fluids that are necessary to rehydrate children with diarrhea. Option A is incorrect because high-sugar drinks can worsen dehydration. Option B is not ideal as water alone does not replenish lost electrolytes. Option D is inappropriate. 4. A nurse is caring for a patient undergoing a colonoscopy. Which of the following should be monitored after the procedure? A. Respiratory status and oxygen saturation levels. B. Blood glucose levels. C. Pain level and comfort. D. Urine output and kidney function. Answer. Respiratory status and oxygen saturation levels. Rationale. After a colonoscopy, sedation can affect respiratory function, so monitoring oxygen levels is important. Option B is not related to the procedure, and Option C may be important, but not as immediate as monitoring respiratory status. Option D is less relevant post-procedure. 5. A nurse is educating a patient with Crohn's disease about managing flare-ups. What is a key recommendation? A. Avoid all dairy products during flare-ups. B. Increase fiber intake to improve digestion. C. Maintain a high-protein, low-fat diet during flare-ups. D. Drink caffeinated beverages to help reduce inflammation. Answer. Avoid all dairy products during flare-ups. Rationale. Dairy products may exacerbate symptoms during a flare-up due to lactose intolerance common in patients with Crohn's disease. Option B is incorrect because high fiber intake can irritate the intestines during flare-ups. Option C may be beneficial, but is not the key recommendation. Option D is not advised. 6. A nurse is caring for a patient with cirrhosis. Which of the following is a common complication of cirrhosis? A. Hypotension. B. Ascites. C. Hypokalemia. D. Hyperglycemia. Answer: ascites. Rationale: ascites is the accumulation of fluid in the abdomen, a common complication in cirrhosis due to liver dysfunction. Option A may occur, but is not a hallmark of cirrhosis. Option C and D are not commonly associated with cirrhosis. 7. Which of the following foods should be avoided by a patient with celiac disease? A. Oats. B. Rice. C. Wheat. D. Corn. Answer: wheat. Rationale: celiac disease is an autoimmune disorder triggered by gluten, which is found in wheat. Oats, rice, and corn are generally gluten-free, so they are safe for patients with celiac disease. 8. A patient with irritable bowel syndrome, IBS, is experiencing diarrhea. What should the nurse recommend? A. Increase fiber intake. B. Avoid dairy products. C. Drink more caffeinated beverages. D. Avoid high-fat foods. Answer: avoid dairy products. Rationale: dairy can exacerbate symptoms of IBS, especially in those who are lactose intolerant. Option A may be beneficial for constipation-predominant IBS, but not during diarrhea. Option C can worsen symptoms, and Option D may help but isn't a primary recommendation. 9. What is the primary goal in the management of patients with peptic ulcers? A. To reduce the acid level in the stomach. B. To increase gastric motility. C. To treat the infection with antibiotics. D. To decrease the size of the ulcer. Answer: to reduce the acid level in the stomach. Rationale: reducing gastric acid through antacids or proton pump inhibitors is the primary goal in treating peptic ulcers. Option B and D are not primary treatment goals, and while antibiotics are important for H. pylori ulcers, the primary focus is acid reduction. 10. Which of the following signs is commonly associated with gallbladder disease? A. Pain in the lower left abdomen. B. Jaundice. C. Pain in the upper right abdomen. D. Nausea and vomiting after meals. Answer: pain in the upper right abdomen. Rationale: pain in the upper right abdomen is a common symptom of gallbladder disease, particularly after eating fatty meals. Jaundice and nausea can also occur, but they are not as specific. 11. A patient with Crohn's disease is experiencing a flare-up. Which of the following is the priority intervention? A. Administering antidiarrheal medications. B. Monitoring vital signs and assessing for signs of infection. C. Encouraging the patient to eat solid foods to promote healing. D. Increasing fiber intake. Answer: monitoring vital signs and assessing for signs of infection. Rationale: during a flare-up, infection and dehydration are major concerns, so monitoring vital signs and assessing for signs of infection is the priority. Option A and C are not appropriate during a flare-up, and fiber intake should be limited. 12. What is the primary function of proton pump inhibitors, PPIs, in the treatment of gastrointestinal disorders? A. To decrease gastric acid production. B. To stimulate gastric motility. C. To increase gastric acid production. D. To neutralize gastric acid. Answer: to decrease gastric acid production. Rationale: proton pump inhibitors reduce the production of gastric acid, helping to treat conditions like GERD, ulcers, and Zollinger-Ellison syndrome. 13. Which dietary modification is most important for a patient with diverticulitis? A. Increasing fiber intake. B. Increasing fluid intake. C. Reducing fat intake. D. Avoiding seeds and nuts. Answer: avoiding seeds and nuts. Rationale: in diverticulitis, avoiding seeds and nuts is recommended to prevent irritation of the diverticula. Fiber may need to be reduced during acute episodes, and fluid intake should be increased. 14. A nurse is caring for a patient undergoing a barium swallow test. What should the nurse instruct the patient to do after the procedure? A. Drink a lot of water to help eliminate the barium. B. Rest and avoid eating for 24 hours. C. Avoid drinking water for 12 hours after the procedure. D. Eat a high-fiber diet for the next 48 hours. Answer: drink a lot of water to help eliminate the barium. Rationale: barium is a contrast agent used in imaging and must be cleared from the system after the test. Drinking plenty of fluids helps prevent constipation. 15. What is the priority action for a nurse caring for a patient with acute pancreatitis? A. Administering opioid pain medication. B. Providing oral fluids. C. Limiting food and fluids until symptoms improve. D. Encouraging early ambulation. Answer: limiting food and fluids until symptoms improve. Rationale: in acute pancreatitis, the pancreas needs to rest, so food and fluids should be limited. Pain management is important, but the priority is controlling the condition. 16. Which of the following is a common cause of cirrhosis? A. Gallstones. B. Hepatitis B or C infections. C. Lactose intolerance. D. Acid reflux disease. Answer: hepatitis B or C infections. Rationale: chronic viral hepatitis, particularly hepatitis B and C, is a common cause of cirrhosis. Gallstones, lactose intolerance, and acid reflux do not directly cause cirrhosis. 17. What is a common symptom of a patient with gastroesophageal reflux disease, GERD? A. Abdominal cramping after meals. B. Persistent heartburn. C. Diarrhea. D. Severe nausea with vomiting. Answer: persistent heartburn. Rationale: persistent heartburn is a hallmark symptom of GERD due to stomach acid refluxing into the esophagus. Other symptoms such as cramping, diarrhea, and nausea are not typically associated with GERD. 18. Which of the following medications is commonly used to treat nausea and vomiting in patients with gastrointestinal disorders? A. Metoclopramide. B. Insulin. C. Ibuprofen. D. Ranitidine. Answer: metoclopramide. Rationale: metoclopramide is an antiemetic that is commonly used to treat nausea and vomiting. Insulin, ibuprofen, and ranitidine are not typically used for nausea and vomiting. 19. Which of the following tests is commonly used to diagnose Crohn's disease? A. Colonoscopy. B. Liver function tests. C. Endoscopy. D. Urinalysis. Answer: colonoscopy. Rationale: colonoscopy is commonly used to diagnose Crohn's disease by allowing direct visualization of the gastrointestinal tract. Liver function tests and urinalysis are not diagnostic for Crohn's disease. 20. A patient with a history of GERD is prescribed a proton pump inhibitor. When should the nurse instruct the patient to take this medication? A. After meals. B. Just before bedtime. C. First thing in the morning, before breakfast. D. Only when experiencing symptoms of heartburn. Answer: first thing in the morning, before breakfast. Rationale: proton pump inhibitors are most effective when taken before meals, especially in the morning, to reduce gastric acid production during the day. 21. A patient with a history of pancreatitis is experiencing severe abdominal pain. What should the nurse do first? A. Administer prescribed analgesics. B. Perform a focused abdominal assessment. C. Encourage the patient to eat a light meal. D. Assess the patient for signs of dehydration. Answer: perform a focused abdominal assessment. Rationale: a focused abdominal assessment should be performed to evaluate the severity of the pain and identify any complications before administering pain medication. 22. A nurse is teaching a patient with a peptic ulcer about medication use. Which statement should the nurse include? A. You should take your antacids after meals. B. Avoid taking your proton pump inhibitors with food. C. Take your antibiotics with dairy products to reduce stomach irritation. D. Take your medications as prescribed, even if you feel better. Answer: take your medications as prescribed, even if you feel better. Rationale: patients with peptic ulcers must complete their full course of treatment, including medications like antibiotics and proton pump inhibitors, even if symptoms improve. 23. Which of the following is a primary cause of ulcerative colitis? A. Genetic factors. B. Viral infections. C. Bacterial infections. D. Poor diet and nutrition. Answer: genetic factors. Rationale: the exact cause of ulcerative colitis is unknown, but it is thought to involve genetic factors and immune system dysfunction. Viral and bacterial infections are not primary causes. 24. Which of the following dietary recommendations is best for a patient with chronic liver disease? A. High protein, low carbohydrate diet. B. Low sodium, low fat diet. C. High sodium, high protein diet. D. Low sodium, high carbohydrate diet. Answer: low sodium, low fat diet. Rationale: a low sodium, low fat diet is recommended for patients with chronic liver disease to prevent fluid retention and manage liver function. 25. Which condition is characterized by an inflammation of the liver, often caused by viral infections? A. Hepatitis. B. Cirrhosis. C. Peptic ulcer disease. D. Gallbladder disease. Answer: hepatitis. Rationale: hepatitis refers to inflammation of the liver, often caused by viral infections such as hepatitis B and C. Cirrhosis, peptic ulcers, and gallbladder disease involve other aspects of gastrointestinal health. 26. What is the first-line treatment for patients with acid reflux or GERD? A. Antacids. B. Proton pump inhibitors. C. H2 blockers. D. Antibiotics. Answer: proton pump inhibitors. Rationale: proton pump inhibitors are the first-line treatment for GERD due to their ability to reduce acid production and heal the esophagus. 27. What is the primary risk factor for colorectal cancer? A. High-fiber diet. B. Family history of colorectal cancer. C. Sedentary lifestyle. D. High-sugar diet. Answer: family history of colorectal cancer. Rationale: a family history of colorectal cancer is a significant risk factor, making it important for patients to undergo regular screenings. High-fiber diet and exercise are protective factors. 28. Which of the following is an early sign of colorectal cancer? A. Blood in the stool. B. Severe abdominal pain. C. Unintentional weight loss. D. Persistent constipation or diarrhea. Answer: blood in the stool. Rationale: blood in the stool is one of the earliest and most common signs of colorectal cancer. Other symptoms may appear later as the disease progresses. 29. Which of the following is a common complication of gallbladder disease? A. Renal failure. B. Jaundice. C. Pulmonary embolism. D. Heart failure. Answer: jaundice. Rationale: gallbladder disease, especially when associated with gallstones, can lead to jaundice due to obstruction of the bile ducts. 30. A patient with Crohn's disease has a new ileostomy. What should the nurse teach the patient about managing the stoma? A. The stoma should be irrigated daily to ensure proper drainage. B. The stoma should remain covered with a sterile dressing at all times. C. The patient should monitor for signs of infection or irritation around the stoma. D. The stoma should be cleaned only once a week. Answer: the patient should monitor for signs of infection or irritation around the stoma. Rationale: monitoring for infection or irritation is crucial to preventing complications with an ileostomy. Regular cleaning and care are important to maintain the stoma. 31. Which of the following is a common symptom of hepatitis B? A. Severe abdominal pain. B. Dark urine and jaundice. C. Persistent cough. D. Low-grade fever. Answer: dark urine and jaundice. Rationale: hepatitis B often causes dark urine and jaundice due to liver dysfunction. Severe abdominal pain is more associated with complications like cirrhosis. 32. What is the main treatment goal for a patient with a gastric ulcer? A. To reduce stomach acid and promote healing of the ulcer. B. To reduce food intake to promote healing. C. To increase stomach acid levels. D. To prevent infection. Answer: to reduce stomach acid and promote healing of the ulcer. Rationale: The main treatment goal for a gastric ulcer is to reduce stomach acid and promote healing through medications like proton pump inhibitors and antacids. 33. Which type of diet is most appropriate for a patient with diverticulosis? A. Low-fiber diet. B. High-fiber diet. C. High-protein diet. D. Low-fat diet. Answer: high-fiber diet. Rationale: a high-fiber diet helps prevent constipation and reduces the risk of diverticulitis in patients with diverticulosis. 34. A patient with chronic liver disease is likely to develop which of the following complications? A. Renal failure. B. Hepatic encephalopathy. C. Acute pancreatitis. D. Pulmonary edema. Answer: hepatic encephalopathy. Rationale: hepatic encephalopathy is a common complication of chronic liver disease, where toxins build up in the brain. 35. What is the primary nursing intervention for a patient with a recent gastrointestinal bleed? A. Administering intravenous fluids and blood products. B. Encouraging the patient to take oral fluids. C. Providing comfort measures for pain relief. D. Applying cold compresses to the abdomen. Answer: administering intravenous fluids and blood products. Rationale: the priority intervention is stabilizing the patient with fluids and blood products to address fluid loss and anemia. 36. A patient with a history of chronic pancreatitis is at risk for which of the following? A. Gallstones. B. Pancreatic cancer. C. Hepatitis C. D. Hyperglycemia. Answer: pancreatic cancer. Rationale: chronic pancreatitis increases the risk of developing pancreatic cancer. 37. What is the most common cause of acute pancreatitis? A. Gallstones. B. Alcohol use. C. Trauma to the pancreas. D. Medications. Answer: gallstones. Rationale: gallstones are the most common cause of acute pancreatitis due to blockage of the bile duct, leading to pancreatic inflammation. 38. A nurse is teaching a patient about managing GERD. Which of the following should the nurse include? A. Avoid large meals and lying down after eating. B. Increase intake of caffeine and alcohol. C. Eat 3 large meals a day to prevent acid reflux. D. Sleep with the head of the bed flat. Answer: avoid large meals and lying down after eating. Rationale: large meals and lying down after eating can exacerbate GERD symptoms. 39. What is a major concern when caring for a patient with cirrhosis of the liver? A. Risk for bleeding due to clotting factor deficiencies. B. Risk for infections due to poor immune function. C. Risk for electrolyte imbalances. D. Risk for hyperglycemia. Answer: risk for bleeding due to clotting factor deficiencies. Rationale: cirrhosis leads to a decrease in clotting factor production, making bleeding a major concern. 40. What is a common sign of liver failure in a patient with cirrhosis? A. Jaundice. B. Cyanosis. C. Hyperthermia. D. Diaphoresis. Answer: jaundice. Rationale: jaundice is a classic sign of liver failure in cirrhosis due to the liver's inability to process bilirubin. 41. What is the most common cause of gastroesophageal reflux disease, GERD? A. Overeating. B. Lower esophageal sphincter dysfunction. C. Decreased gastric acid production. D. Increased peristalsis. Answer: lower esophageal sphincter dysfunction. Rationale: GERD is most often caused by dysfunction of the lower esophageal sphincter, which allows stomach acid to flow into the esophagus. 42. Which of the following dietary modifications is recommended for a patient with celiac disease? A. High-protein, low-carbohydrate diet. B. Gluten-free diet. C. High-sugar, low-fat diet. D. Vegetarian diet. Answer: gluten-free diet. Rationale: a gluten-free diet is essential for managing celiac disease and preventing an immune response. 43. A patient is undergoing a colonoscopy. What is an important nursing action before the procedure? A. Ensure the patient is NPO for at least 8 hours prior to the procedure. B. Administer a sedative to ensure the patient is relaxed. C. Encourage the patient to eat a light meal the night before. D. Ensure the patient has a full stomach for comfort. Answer. Ensure the patient is NPO for at least 8 hours prior to the procedure. Rationale. The patient must be NPO, nothing by mouth, for at least 8 hours before a colonoscopy to ensure the bowel is clear for the procedure. 44. Which of the following medications is used to treat H. pylori infection in peptic ulcer disease? A. Proton pump inhibitors. B. Antacids. C. Antibiotics. D. H2 blockers. Answer. Antibiotics. Rationale. H. pylori infection is typically treated with antibiotics, often in combination with proton pump inhibitors. 45. A patient has been diagnosed with colorectal cancer. What is the primary goal of treatment? A. To decrease the size of the tumor and prevent metastasis. B. To increase the patient's appetite. C. To improve bowel movement frequency. D. To increase fluid intake. Answer. To decrease the size of the tumor and prevent metastasis. Rationale. The primary goal of treatment for colorectal cancer is to reduce the tumor and prevent the spread of cancer cells. 46. A patient with liver cirrhosis is experiencing ascites. Which of the following interventions should be prioritized? A. Administering diuretics. B. Encouraging the patient to ambulate. C. Limiting fluid intake. D. Increasing sodium intake. Answer. Administering diuretics. Rationale. Diuretics are used to reduce ascites by helping the body eliminate excess fluid. 47. A nurse is caring for a patient who is undergoing a barium enema. What is an important post-procedure action? A. Encourage the patient to increase fluid intake to help eliminate the barium. B. Instruct the patient to avoid eating for 12 hours. C. Apply a cold compress to the abdominal area. D. Restrict the patient's movement for 24 hours. Answer. Encourage the patient to increase fluid intake to help eliminate the barium. Rationale. Barium used in a barium enema can cause constipation, so increasing fluid intake helps prevent this. 48. A patient with pancreatitis is being treated with 4 fluids and antibiotics. Which of the following lab values should be closely monitored? A. Blood glucose levels. B. White blood cell count. C. Serum amylase and lipase levels. D. Blood urea nitrogen, BUN. Answer. Serum amylase and lipase levels. Rationale. Amylase and lipase levels are elevated in pancreatitis, and monitoring these helps assess the severity of the condition. 49. A nurse is preparing a patient for a gastric bypass surgery. Which of the following should the nurse include in preoperative teaching? A. The patient will be able to eat any foods after the procedure. B. The patient may need to take vitamin supplements after the surgery. C. The surgery will involve the removal of the stomach. D. The procedure has no dietary restrictions post-operatively. Answer. The patient may need to take vitamin supplements after the surgery. Rationale. Patients who undergo gastric bypass surgery often require vitamin and mineral supplements due to changes in nutrient absorption. 50. Which of the following is an appropriate nursing intervention for a patient experiencing nausea and vomiting from chemotherapy? A. Encourage the patient to consume large, fatty meals. B. Offer small, frequent meals and hydration. C. Encourage the patient to eat only sweet foods. D. Withhold all fluids for 24 hours to allow the stomach to rest. Answer. Offer small, frequent meals and hydration. Rationale. Small, frequent meals and proper hydration can help reduce nausea and vomiting. 51. What is the main goal of treatment for Crohn's disease? A. To promote weight gain and improve digestion. B. To manage inflammation and prevent flare-ups. C. To increase protein intake. D. To promote strict bed rest. Answer. To manage inflammation and prevent flare-ups. Rationale. The primary goal in treating Crohn's disease is to manage inflammation and prevent flare-ups through medications and dietary adjustments. 52. Which of the following is an expected finding in a patient with a peptic ulcer? A. severe diarrhea. B. Abdominal bloating and nausea. C. Persistent, sharp abdominal pain that worsens after eating. D. Pain that improves after eating. Answer: persistent, sharp abdominal pain that worsens after eating. Rationale: patients with peptic ulcers typically experience abdominal pain that worsens after eating, as stomach acid irritates the ulcer. 53. A patient is receiving long-term proton pump inhibitor therapy. Which of the following complications should the nurse monitor for? A. Hypocalcemia. B. Hyperkalemia. C. Hypoglycemia. D. Hypercalcemia. Answer: hypocalcemia. Rationale: long-term use of proton pump inhibitors can interfere with calcium absorption, leading to hypocalcemia. 54. A patient with an ileostomy is asking about diet restrictions. What is the nurse's best response? A. You should avoid high-fiber foods that could cause blockages. B. You should eat foods high in fiber to regulate bowel function. C. You should avoid foods with a high fat content. D. You should only consume liquids for the first few weeks. Answer: you should avoid high-fiber foods that could cause blockages. Rationale: patients with ileostomies should avoid high-fiber foods that can cause blockages in the stoma. 55. Which of the following is the most common cause of acute diarrhea in adults? A. Viral infections. B. Bacterial infections. C. Food allergies. D. Stress. Answer: viral infections. Rationale: viral infections, such as norovirus and rotavirus, are the most common causes of acute diarrhea in adults. 56. A nurse is caring for a patient with acute pancreatitis. Which of the following is an expected assessment finding? A. Severe right upper quadrant pain radiating to the back. B. Abdominal distension and hypovolemia. C. Jaundice and low-grade fever. D. Diarrhea and weight loss. Answer: abdominal distension and hypovolemia. Rationale: acute pancreatitis often leads to abdominal distension and hypovolemia due to fluid shifts and inflammation. 57. What is the most effective method to prevent the spread of hepatitis A in a healthcare setting? A. Administration of hepatitis A vaccine to all staff members. B. Frequent hand washing and sanitation of surfaces. C. Providing antiviral medications to exposed patients. D. Restricting access to patients with hepatitis A. Answer: frequent hand washing and sanitation of surfaces. Rationale: hepatitis A is transmitted primarily through fecal-oral contact, making hand washing and surface sanitation the most effective prevention method. 58. A patient with Crohn's disease is prescribed corticosteroids. What is the primary purpose of this treatment? A. To reduce inflammation in the gastrointestinal tract. B. To treat bacterial infections. C. To promote wound healing in the intestines. D. To replace nutrients lost during malabsorption. Answer: to reduce inflammation in the gastrointestinal tract. Rationale: corticosteroids are used to reduce inflammation during flare-ups of Crohn's disease. 59. What is a common side effect of proton pump inhibitors, PPIs, in patients with long-term use? A. Hypokalemia. B. Increased risk of bone fractures. C. Hyperglycemia. D. Weight gain. Answer: increased risk of bone fractures. Rationale: long-term PPI use can reduce calcium absorption, increasing the risk of fractures. 60. Which of the following is a typical symptom of irritable bowel syndrome, IBS? A. Chronic, intermittent abdominal pain with changes in bowel habits. B. Continuous fever and weight loss. C. Severe abdominal cramping and vomiting. D. Blood in the stool with severe pain. Answer: chronic, intermittent abdominal pain with changes in bowel habits. Rationale: IBS is characterized by chronic abdominal pain and changes in bowel habits, such as diarrhea or constipation. 61. A nurse is caring for a patient with liver cirrhosis. Which of the following lab results would the nurse expect to find? A. Elevated serum albumin levels. B. Decreased prothrombin time. C. Elevated liver enzymes, AST, ALT. D. Low white blood cell count. Answer. Elevated liver enzymes, AST, ALT. Rationale. In liver cirrhosis, elevated liver enzymes, AST, ALT, are commonly seen due to liver damage and dysfunction. 62. What is a common complication of untreated gastroesophageal reflux disease, GERD? A. Esophageal strictures. B. Gastric ulcers. C. Bowel obstruction. D. Colorectal cancer. Answer. Esophageal strictures. Rationale. Long-term GERD can lead to esophageal strictures, which cause narrowing of the esophagus. 63. Which of the following should a nurse monitor for in a patient with a newly inserted nasogastric tube? A. Gastric distension. B. Excessive coughing and gagging. C. Decreased urinary output. D. Difficulty breathing. Answer. Gastric distension. Rationale. Gastric distension can occur if the nasogastric tube is not positioned correctly or if there is a blockage. 64. Which of the following lab results is associated with chronic liver disease? A. Decreased bilirubin levels. B. Increased INR, international normalized ratio. C. Decreased hemoglobin levels. D. Elevated potassium levels. Answer. Increased INR, international normalized ratio. Rationale. Chronic liver disease impairs the liver's ability to produce clotting factors, resulting in an increased INR. 65. A patient with a history of chronic liver disease presents with confusion and disorientation. What is the likely cause? A. Hepatic encephalopathy. B. Delirium tremens. C. Hypoxia. D. Dehydration. Answer. Hepatic encephalopathy. Rationale. Hepatic encephalopathy is a common complication of liver disease, causing confusion and altered mental status due to the buildup of toxins in the brain. 66. What is the primary goal of treatment for a patient with ulcerative colitis? A. To promote remission and prevent flare-ups. B. To increase the intake of high-fiber foods. C. To reduce fluid intake to prevent diarrhea. D. To administer pain medications regularly. Answer. To promote remission and prevent flare-ups. Rationale. The goal of ulcerative colitis treatment is to reduce inflammation and maintain remission through medications and lifestyle changes. 67. What is the primary concern when caring for a patient undergoing paracentesis for ascites? A. Infection at the puncture site. B. Hypovolemia due to fluid loss. C. Pain at the site of the procedure. D. Increased intra-abdominal pressure. Answer. Hypovolemia due to fluid loss. Rationale. Paracentesis involves the removal of fluid from the abdomen, which can lead to hypovolemia if not carefully managed. 68. Which of the following is a common complication of peritoneal dialysis in patients with kidney failure? A. Peritonitis. B. Hypertension. C. Gallstones. D. Gastroesophageal reflux. Answer. Peritonitis. Rationale. Peritonitis is a common complication of peritoneal dialysis due to infection of the peritoneum. 69. What is the best initial treatment for a patient with acute liver failure? A. Administering 4 fluids and electrolytes. B. Giving high doses of corticosteroids. C. Providing a liver transplant. D. Administering oral medications to reduce inflammation. Answer. Administering 4 fluids and electrolytes. Rationale. 4 fluids and electrolytes are essential to stabilize patients with acute liver failure before further interventions like a liver transplant. 70. A patient has been prescribed lactulose for hepatic encephalopathy. What is the expected outcome of this medication? A. Decreased ammonia levels in the blood. B. Increased bile production. C. Increased absorption of nutrients. D. Reduced gastrointestinal motility. Answer. Decreased ammonia levels in the blood. Rationale. Lactulose helps lower blood ammonia levels by promoting its excretion through the stool. 71. A patient with an ileostomy asks about food restrictions. What is the best response from the nurse? A. Avoid foods high in fiber and nuts to prevent blockages. B. You can eat anything as long as you drink plenty of fluids. C. Avoid all dairy products to prevent complications. D. Only eat soft foods for the first month after surgery. Answer. Avoid foods high in fiber and nuts to prevent blockages. Rationale. Patients with ileostomies should avoid high-fiber foods and nuts, which can lead to blockages. 72. What is a common complication of gallbladder surgery, cholecystectomy? A. Bile duct injury. B. Hemorrhage. C. Pneumonia. D. Gastrointestinal bleeding. Answer. Bile duct injury. Rationale. Bile duct injury is a known risk in cholecystectomy due to the proximity of the gallbladder to the bile duct. 73. Which of the following conditions is most likely to cause a patient to develop steatorrhea? A. Cystic fibrosis. B. Hypertension. C. Peptic ulcer disease. D. Diarrhea. Answer. Cystic fibrosis. Rationale. Cystic fibrosis can cause steatorrhea due to the lack of pancreatic enzymes necessary for fat digestion. 74. What is the most common cause of hemorrhoids? A. Straining during bowel movements. B. Sedentary lifestyle. C. Inadequate fluid intake. D. Overuse of laxatives. Answer. Straining during bowel movements. Rationale. Straining during bowel movements can increase pressure on veins in the rectal area, leading to hemorrhoids. 75. A patient is experiencing melena. What is the likely source of this symptom? A. Upper gastrointestinal bleeding. B. Lower gastrointestinal bleeding. C. Gastric reflux. D. Peptic ulcers. Answer. Upper gastrointestinal bleeding. Rationale. Melena is black, tarry stool often resulting from upper gastrointestinal bleeding, typically from ulcers. 76. A patient undergoing chemotherapy reports nausea and vomiting. Which of the following is an effective nursing intervention? A. Administering antiemetic medications as prescribed. B. Encouraging high-fat meals to reduce nausea. C. Limiting fluid intake to prevent vomiting. D. Suggesting heavy exercise to reduce symptoms. Answer. Administering antiemetic medications as prescribed. Rationale. Antiemetic medications are commonly prescribed to manage chemotherapy-induced nausea and vomiting. 77. What is the most common cause of peptic ulcer disease? A. Infection with Helicobacter pylori. B. Chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs. C. Excessive alcohol consumption. D. Smoking. Answer. Infection with Helicobacter pylori. Rationale. Helicobacter pylori infection is the most common cause of peptic ulcer disease, leading to mucosal damage in the stomach or duodenum. 78. A nurse is caring for a patient with a history of cirrhosis. What is the most concerning sign of worsening liver failure? A. Jaundice and ascites. B. Altered mental status and confusion. C. Increased urine output. D. Severe abdominal pain. Answer. Altered mental status and confusion. Rationale. Altered mental status and confusion are signs of hepatic encephalopathy, a severe complication of liver failure. 79. What dietary change is recommended for patients with celiac disease? A. A gluten-free diet. B. A high-fiber diet. C. A low-fat diet. D. A lactose-free diet. Answer. A gluten-free diet. Rationale. Celiac disease requires a strict gluten-free diet to prevent damage to the small intestine. 80. A patient with chronic pancreatitis is experiencing steatorrhea. What should the nurse suggest? A. Increasing fat intake. B. Taking pancreatic enzyme replacements with meals. C. Decreasing protein intake. D. Avoiding all dairy products. Answer. Taking pancreatic enzyme replacements with meals. Rationale. Pancreatic enzyme replacements help digest fats and prevent steatorrhea in patients with chronic pancreatitis. 81. A patient with acute liver failure is at risk for which of the following? A. Hepatorenal syndrome. B. Hypertension. C. Pneumonia. D. Stroke. Answer: hepatorenal syndrome. Rationale: hepatorenal syndrome is a serious complication of acute liver failure characterized by kidney dysfunction. 82. What is a common sign of gastrointestinal bleeding in a patient with cirrhosis? A. Hematemesis, vomiting blood. B. Abdominal distension and bloating. C. Increased bowel movements. D. Decreased appetite. Answer: hematemesis, vomiting blood. Rationale: hematemesis is a common sign of gastrointestinal bleeding in cirrhotic patients due to variceal rupture. 83. Which of the following is the most likely cause of dysphagia in patients with a history of stroke? A. Neurological impairment affecting the swallowing reflex. B. Esophageal motility disorders. C. Hiatal hernia. D. Peptic ulcer disease. Answer: neurological impairment affecting the swallowing reflex. Rationale: dysphagia in stroke patients is commonly caused by neurological impairment, particularly in the brain regions controlling swallowing. 84. Which is the first step in the management of acute pancreatitis? A. Administering 4 fluids. B. Administering antibiotics. C. Performing surgery. D. Administering pain medications. Answer: administering 4 fluids. Rationale: 4 fluids are essential for rehydration and supporting blood pressure in acute pancreatitis. 85. A patient with gastrointestinal reflux disease, GERD, is prescribed proton pump inhibitors, PPIs. Which should the nurse monitor? A. Serum magnesium levels. B. Liver enzyme levels. C. Serum potassium levels. D. Blood glucose levels. Answer: serum magnesium levels. Rationale: long-term PPI use can cause hypomagnesemia, requiring monitoring of serum magnesium levels. 86. A patient is receiving total parenteral nutrition, TPN. What is the primary concern for the nurse? A. Infection at the insertion site of the catheter. B. Hyperkalemia. C. Hypoglycemia. D. Dehydration. Answer: infection at the insertion site of the catheter. Rationale: infection at the catheter insertion site is a major concern for patients receiving TPN, requiring close monitoring for signs of infection. 87. A nurse is caring for a patient with diverticulitis. Which of the following is the priority action? A. Administering antibiotics. B. Encouraging high-fiber foods. C. Administering laxatives. D. Encouraging fluid restriction. Answer: administering antibiotics. Rationale: antibiotics are used to treat diverticulitis, an infection or inflammation of diverticula in the colon. 88. A patient with Crohn's disease is experiencing a flare-up. What is the priority intervention? A. Administering corticosteroids. B. Encouraging high-fiber foods. C. Giving antidiarrheal medications. D. Promoting increased fluid intake. Answer: administering corticosteroids. Rationale: corticosteroids are used to reduce inflammation and control flare-ups in Crohn's disease. 89. What is the primary purpose of a colonoscopy in a patient with a family history of colorectal cancer? A. To screen for colorectal cancer. B. To treat hemorrhoids. C. To relieve constipation. D. To evaluate for peptic ulcers. Answer: to screen for colorectal cancer. Rationale: colonoscopy is used for colorectal cancer screening, particularly for patients with a family history. 90. Which of the following should be avoided in a patient with a history of peptic ulcers? A. Spicy foods. B. High-fiber foods. C. Milk and dairy products. D. Low-fat foods. Answer: spicy foods. Rationale: spicy foods can irritate the stomach lining and exacerbate peptic ulcers. 91. What is the primary goal of nutritional therapy for a patient with cirrhosis? A. To prevent malnutrition and support liver function. B. To increase protein intake for healing. C. To reduce sodium intake to prevent fluid retention. D. To promote weight loss. Answer: To prevent malnutrition and support liver function. Rationale. The goal is to prevent malnutrition and provide adequate nutrition to support liver function in cirrhosis. 92. A patient is experiencing early signs of peritonitis. What should the nurse anticipate? A. Abdominal tenderness and rigidity. B. Increased appetite and weight gain. C. Low-grade fever and lethargy. D. Vomiting and diarrhea. Answer. Abdominal tenderness and rigidity. Rationale. Early signs of peritonitis include abdominal tenderness and rigidity, often accompanied by fever. 93. A patient with a history of peptic ulcers is prescribed antacids. What is the primary nursing consideration? A. Assessing for signs of renal dysfunction. B. Monitoring for signs of gastric bleeding. C. Monitoring for constipation. D. Administering the medication 1 hour after meals. Answer. Monitoring for signs of gastric bleeding. Rationale. Antacids can increase the pH of gastric contents, reducing ulcer-related pain but also potentially masking signs of gastric bleeding. 94. Which of the following is a characteristic sign of irritable bowel syndrome, IBS? A. Abdominal pain relieved by defecation. B. Severe weight loss. C. Persistent nausea and vomiting. D. Blood in the stool. Answer. Abdominal pain relieved by defecation. Rationale. Abdominal pain that is relieved by defecation is a hallmark symptom of IBS. 95. A patient with a history of gallstones is experiencing severe upper abdominal pain. What is the priority nursing intervention? A. Administering pain medications as prescribed. B. Encouraging the patient to drink fluids. C. Providing a low-fat meal. D. Performing a physical assessment. Answer. Administering pain medications as prescribed. Rationale. Pain management is a priority for patients with gallstones experiencing biliary colic or severe abdominal pain. 96. A patient with acute cholecystitis is scheduled for surgery. What is the nurse's primary concern before the procedure? A. Ensuring the patient is fasting. B. Monitoring for signs of infection. C. Providing emotional support. D. Assessing for signs of dehydration. Answer. Ensuring the patient is fasting. Rationale. Fasting is necessary before surgery to reduce the risk of aspiration and to prepare for anesthesia. 97. What is a major risk factor for the development of colorectal cancer? A. A family history of colorectal cancer. B. Chronic constipation. C. High-fiber diet. D. Smoking. Answer. A family history of colorectal cancer. Rationale. A family history of colorectal cancer is a significant risk factor for developing the condition. 98. What is a common complication in patients with cirrhosis that affects clotting? A. Thrombocytopenia. B. Hypercoagulability. C. Hypofibrinogenemia. D. Vitamin K deficiency. Answer. Thrombocytopenia. Rationale. Thrombocytopenia occurs in cirrhosis due to splenic sequestration and impaired platelet production. 99. A nurse is educating a patient with gastroesophageal reflux disease, GERD, about lifestyle modifications. What is the most important advice? A. Avoid eating large meals before bedtime. B. Increase intake of acidic foods. C. Lie down immediately after eating. D. Eat large meals to prevent reflux. Answer. Avoid eating large meals before bedtime. Rationale. Eating large meals before bedtime can exacerbate GERD symptoms, as it increases gastric pressure and reflux. 100. A patient with a history of liver cirrhosis is at risk for which of the following complications? A. Spontaneous bacterial peritonitis. B. Acute pancreatitis. C. Pulmonary embolism. D. Renal failure. Answer. Spontaneous bacterial peritonitis. Rationale. Patients with cirrhosis, especially those with ascites, are at an increased risk for spontaneous bacterial peritonitis due to impaired immune function. 101. What is the primary diagnostic tool for diagnosing acute pancreatitis? A. Abdominal ultrasound. B. Serum amylase and lipase levels. C. Colonoscopy. D. CT scan of the abdomen. Answer: serum amylase and lipase levels. Rationale: elevated serum amylase and lipase levels are diagnostic markers for acute pancreatitis. 102. What is the most important intervention for managing a patient with ascites due to cirrhosis? A. Administering diuretics. B. Encouraging increased fluid intake. C. Providing a high-sodium diet. D. Performing paracentesis. Answer: administering diuretics. Rationale: diuretics are commonly used to manage ascites and cirrhosis by reducing fluid accumulation. 103. Which of the following is a common cause of acute hepatitis? A. Hepatitis A virus infection. B. Gallstones. C. Alcohol abuse. D. Crohn's disease. Answer: hepatitis A virus infection. Rationale: hepatitis A is a common cause of acute hepatitis, often transmitted via contaminated food or water. 104. What is the most appropriate dietary recommendation for a patient with lactose intolerance? A. Avoid all dairy products. B. Limit intake of high-protein foods. C. Eat dairy products with lactase enzyme supplements. D. Increase fiber intake. Answer: eat dairy products with lactase enzyme supplements. Rationale: lactase enzyme supplements can help break down lactose, allowing patients to tolerate small amounts of dairy. 105. Which of the following is the most likely cause of a patient's bloody diarrhea? A. Clostridium difficile infection. B. Lactose intolerance. C. Gastroesophageal reflux disease, GERD. D. Irritable bowel syndrome. Answer: Clostridium difficile infection. Rationale: Clostridium difficile infection is a common cause of bloody diarrhea, especially following antibiotic use. 106. What is the initial treatment for a patient with a suspected bowel obstruction? A. Administering intravenous fluids and electrolytes. B. Encouraging oral intake. C. Administering pain medications. D. Performing an abdominal X-ray. Answer: administering intravenous fluids and electrolytes. Rationale: for fluids and electrolyte correction are critical for managing bowel obstruction before further interventions. 107. What is the primary complication of untreated Crohn's disease? A. Intestinal perforation. B. Peptic ulcer disease. C. Colon cancer. D. Liver cirrhosis. Answer: intestinal perforation. Rationale: untreated Crohn's disease can lead to complications like intestinal perforation, abscess, and strictures. 108. What is the first-line treatment for Helicobacter pylori infection? A. Proton pump inhibitors, PPIs, and antibiotics. B. Antacids and H2 blockers. C. Antimotility agents. D. Antifungal medications. Answer: proton pump inhibitors, PPIs, and antibiotics. Rationale: a combination of PPIs and antibiotics is the first-line treatment for Helicobacter pylori infection. 109. A patient with cirrhosis develops hepatic encephalopathy. What is the primary treatment? A. Lactulose. B. Antibiotics. C. Diuretics. D. Vitamin K supplements. Answer: lactulose. Rationale: lactulose helps reduce ammonia levels in the blood, which can cause hepatic encephalopathy. 110. A nurse is caring for a patient with a history of diverticulitis. What dietary recommendation should be made once symptoms resolve? A. High-fiber diet. B. Low-fiber diet. C. Low-fat diet. D. High-protein diet. Answer: high-fiber diet. Rationale: a high-fiber diet is recommended after diverticulitis symptoms resolve to prevent future episodes. 111. What is a key sign of liver failure in a patient with cirrhosis? A. Jaundice. B. Hypertension. C. Hyperkalemia. D. Tachycardia. Answer: jaundice. Rationale: jaundice, a yellowing of the skin and eyes, is a key sign of liver failure in cirrhosis. 112. A patient with a history of GERD reports nocturnal heartburn. What is the best recommendation? A. Elevate the head of the bed while sleeping. B. Drink milk before bed. C. Avoid medications that decrease stomach acid. D. Eat large meals late at night. Answer: elevate the head of the bed while sleeping. Rationale: elevating the head of the bed helps prevent gastric reflux during sleep, reducing symptoms of GERD. 113. A patient with a history of peptic ulcer disease asks if spicy foods are safe to eat. What is the nurse's best response? A. Spicy foods can irritate your stomach and should be avoided. B. Spicy foods are fine to eat if you take antacids beforehand. C. Spicy foods are recommended to help with digestion. D. You can eat spicy foods in moderation. Answer: spicy foods can irritate your stomach and should be avoided. Rationale: spicy foods can aggravate the mucosal lining of the stomach and exacerbate peptic ulcers. 114. What is a typical symptom of a peptic ulcer? A. Burning stomach pain that improves with eating. B. Nausea and vomiting. C. Diarrhea and bloating. D. Abdominal distension and fever. Answer: burning stomach pain that improves with eating. Rationale: the characteristic symptom of a peptic ulcer is burning stomach pain that often improves after eating. 115. Which test is commonly used to diagnose celiac disease? A. Serum tissue transglutaminase (TTG) antibody test. B. Abdominal ultrasound. C. Colonoscopy. D. Endoscopy with biopsy. Answer: serum tissue transglutaminase (TTG) antibody test. Rationale: the TTG antibody test is a common diagnostic tool for celiac disease. 116. What is the most common complication of untreated hepatitis B? A. Chronic liver disease and cirrhosis. B. Stomach ulcers. C. Pancreatitis. D. Gallstones. Answer: chronic liver disease and cirrhosis. Rationale: untreated hepatitis B can progress to chronic liver disease and cirrhosis over time. 117. Which dietary modification should be made for a patient with gallstones? A. Low-fat diet. B. High-protein diet. C. High-fiber diet. D. High-carbohydrate diet. Answer: low-fat diet. Rationale: a low-fat diet is recommended for patients with gallstones to reduce gallbladder stimulation and prevent attacks. 118. What is a typical sign of an acute gastrointestinal bleed? A. Hematemesis, vomiting blood. B. Increased appetite. C. Decreased blood pressure. D. Increased bowel sounds. Answer: hematemesis, vomiting blood. Rationale: hematemesis, or vomiting blood, is a typical sign of acute gastrointestinal bleeding. 119. A patient with a history of cirrhosis develops spontaneous bacterial peritonitis, SBP. What is the most important intervention? A. Administering broad-spectrum antibiotics. B. Encouraging fluid intake. C. Providing pain relief. D. Restricting sodium intake. Answer: administering broad-spectrum antibiotics. Rationale: SBP requires prompt antibiotic treatment to prevent severe complications in cirrhosis. 120. Which of the following is a common cause of a ruptured appendix? A. Obstruction of the appendix lumen. B. Crohn's disease. C. Peptic ulcer disease. D. Irritable bowel syndrome. Answer: obstruction of the appendix lumen. Rationale: obstruction of the appendix lumen by fecal matter, a foreign body, or a tumor can lead to appendicitis and possible rupture.